The organization 0 to 3 publishes a yearly report on the condition of infants and toddlers. This report provides a national and state-by-state look into the health, safety, educational experiences, and family conditions of children under 3 years of age and their families' caregivers. The report is long, but presents eye-opening findings about the state of infants and toddlers in the United States. A link to the full report will be in the description below. This video will summarize a few of the main findings from the national report. The results of the report are clear. The state a child is born in and raised in is related to an unequal distribution of access to health and educational opportunities. Furthermore, there are significant disparities based on race, ethnicity, and family income level. In summary, within just the first 3 years of a child's life, the individual differences and larger group disparities establish an unequal developmental foundation, but states are striving toward change, and we as parents and teachers can play a significant role in this change toward improvement. To examine the national state of infants and toddlers, a 4-tier ranking system was used. Getting started is the lowest ranked tier. Reaching forward is the third highest ranked tier. Improving outcomes is the second highest ranked tier, and working effectively is the highest ranked tier. States were given an individual ranking for 3 specific developmental domains: good health, strong families, and positive early learning experiences, and were given an overall ranking that combined those 3 individual domains. States varied in their overall rankings, suggesting that the state an infant or toddler is in has the potential to lead to very different developmental outcomes. States that received the highest ranking, working effectively, included Connecticut, District of Columbia, Iowa, Maine, Maryland, Massachusetts, New Hampshire, Oregon, Pennsylvania, Rhode Island, Vermont, and Washington State. States that received the second to highest ranking, improving outcomes, included Alaska, Colorado, Delaware, Hawaii, Idaho, Minnesota, Missouri, Montana, New Jersey, North Carolina, Ohio, South Dakota, and Wisconsin. States that received the third to highest ranking, reaching forward, included California, Florida, Illinois, Kansas, Michigan, Nebraska, New York, North Dakota, Tennessee, Utah, Virginia, West Virginia, and Wyoming. States that received the lowest ranking, getting started, included Alabama, Arizona, Arkansas, Georgia, Indiana, Kentucky, Louisiana, Mississippi, Nevada, New Mexico, Oklahoma, South Carolina, and Texas. Seeing the rankings within an illustrated national map allows for the recognition of important patterns. The map on the screen shows the overall rankings for all 50 states and the District of Columbia together. The spectrum of blue colors represent the rankings. The darker the blue, the higher the ranking. Looking at this national map reveals a few patterns. More northern states are higher ranked compared to southern states. States in the Northwest and Northeast were some of the highest ranked states. States along the southern part of the country were some of the lowest ranked states. While each state can be explored individually, this video will summarize a few of the main findings from the overall national report. An in-depth look into the state of California was presented in another video. I will provide a link to that video in the description below. For the domain of good health, there are a few key indicators worth examining. Nationally, 1 in 10 children, 10%, are born preterm. There is a racial disparity for preterm births. The preterm birth rate for Black women, 14.1%, and Hispanic Latinx women, 9.7%, is higher than the rate for white women, 9.1%. Preterm birth rates also differed by race across states. For Black women, the preterm birth rate was highest in Mississippi, 17.3%, and lowest in South Dakota, 7.7%. Nationally, 1 in 12, 8.3%, of newborns have a low birth weight. There is a large racial disparities for babies born with a low birth weight. The low birth weight rate for Black women, 14.1%, and Hispanic Latinx women, 7.5%, are higher than the rate for white women, 6.9%. Low birth weight rates also differed by race across states. For Hispanic Latinx women, the low birth weight rate was highest in Montana, 10.4%, and lowest in Alaska, 5.8%. Despite the health and economical benefits of breastfeeding, there are differences based on race ethnicity for mothers who have ever breastfed their baby. Nationally, 85.7% of Hispanic Latinx mothers, 85.2% of white mothers, and 68.9% of Black mothers ever breastfed their baby. The proportion of mothers still breastfeeding when their baby is 6 months of age sharply decreases. For example, while Hispanic Latinx mothers had the highest percentage of mothers who initiated breastfeeding, 6 months later, only 52.5% of Hispanic Latinx mothers were still breastfeeding. Families with lower incomes were less likely to initiate breastfeeding and less likely to continue to be breastfeeding when the baby was 6 months old. The national infant mortality rate is high, at 5.8 deaths per 1,000 births. However, infant mortality is more than twice as high for Black infants, 11.1 per 1,000 births, as it is for white infants, 4.8 per 1,000 births. The national maternal mortality rate is 17 deaths per 100,000 live births. The maternal mortality rate for Black mothers, 40.8 per 100,000 live births, is more than 3 times higher than the rate for white mothers, 13.2 per 100,000 live births. 19.8% of mothers with infants and toddlers rate their own mental health as worse than excellent or very good. Mothers with lower incomes were more likely to report lower levels of optimal mental health compared to mothers with higher incomes. For the domain of strong families, there are a few key indicators worth examining. Nationally, 15.5% of infants and toddlers live in crowded housing. However, this statistic differed greatly across states. The state with the lowest level of crowded housing was West Virginia at 5.6%, compared to the state with the highest level of crowded housing, California, at 28.4%. Infants and toddlers of color were more likely to experience crowded housing, 29% for Hispanic Latinx families and 17.6% for Black families, compared to just 7.6% of white families. Across all states, families with lower incomes were more likely to experience crowded housing. Nationally, 2.7% of infants and toddlers experience housing instability, moving 3 or more times since birth. Families with low incomes are more than twice as likely to experience housing instability. Nationally, 5.8% of infants and toddlers live in neighborhoods that the parents feel are unsafe. Families with low incomes are more than twice as likely to live in unsafe neighborhoods. Nationally, 16 per 1,000 children ages 0 to 2 experience abuse or neglect. This is the highest rate of any age group. The state with the highest reported abuse and neglect of infants and toddlers is Michigan, at 38.2 per 1,000 children. Nationally, 22.4% of infants and toddlers have already been exposed to at least one adverse childhood experience. 33.2% of infants and toddlers from low-income families had already been exposed to one adverse experience, compared to only 15% of families with higher incomes. Nevada reported the highest percent of infants and toddlers exposed to at least one adverse childhood experience at 52.8%. Nationally, 8.6% of infants and toddlers have already been exposed to 2 or more adverse experiences. Although the majority of states have less than 10% of infants and toddlers who have been exposed to 2 or more adverse experiences, there are significant differences across states. While only 1.2% of infants and toddlers in Maryland have been exposed to 2 or more adverse experiences, 20.9% of infants and toddlers have been exposed in Oklahoma. 15.1% of infants and toddlers from low-income families have already been exposed to 2 or more adverse experiences, compared to only 4.1% of families with higher incomes. For the domain of positive early learning experiences, there are a few key indicators worth examining. Nationally, only 37.8% of infants and toddlers are read to every day. California is a state with the lowest percentage of infants and toddlers who are read to every day, at just 28.2%, while Vermont has the highest percentage at 59.4%. This percentage in California is shockingly low, and the highest reported percent at 59.4% is still surprisingly low, considering the well-recognized importance of reading, the free access to literacy resources at libraries, and the easily integrated role of books into sleep routines. A long-standing finding is that the quantity and quality of language exposure children receive is related to the income level of their parents. The findings from this report corroborate the long-standing findings. Only 28.9% of low-income families read to their infants and toddlers every day, compared to 43.9% of higher-income families. In California, only 14.5% of low-income families read every day, the lowest percentage in the nation. Singing, while more common than reading, is still very low. Nationally, only 57.6% of parents sang to their infants and toddlers. Mississippi reported the lowest levels of singing, 47.2%, and Vermont reported the highest levels, 70.8%. 62.9% of higher income families sang or told stories every day, compared to 49.9% of low income families. Nationally, only 6 states require teachers of infants and toddlers to have either a Child Development Associate, CDA, credential or state equivalent. Stated reversely, 45 states do not require infant-toddler teachers to have any credential above a high school diploma. Nationally, only 31.1% of infants and toddlers received a developmental screening in the past year. Florida conducted the least amount of developmental screenings, as just 16% of children under 3 years of age in Florida received a screening. Infants and toddlers in low-income families are less likely to receive a developmental screening than higher-income families, at 33.9% and 26.9% respectively. Mississippi conducted the fewest screenings, 14.8%, and Oregon conducted the most, 66.6%.